Welcome to On Call, Paging the Frontlines of the Future, a podcast powered by Project Unity. I'm Hargun Setcher, your host, and a proud member of Project Unity, a student-led initiative transforming how we talk about healthcare. At Project Unity, we believe meaningful health innovation begins by listening, not just to professionals, but to young people living and leading within today's health systems. This podcast brings youth into dialogue with experts across medicine, public health, and digital health to explore real stories, pressing challenges, and bold ideas, reshaping health equity in schools, clinics, and communities. Whether you're a student leader, an educator, or a healthcare professional, you are in the right place. This is where emerging voices and experienced minds come together to reimagine the future of health. Today, we are honored to welcome Dr. Nitin Shah, Professor of Anesthesiology and Critical Care at Loma Linda University Health, and the former chief of the Surgical ICU at the Long Beach, Virginia Medical Center. He is also the founder of the Anicam Community Center and Aparigrah Foundation, which has organized more than 927 humanitarian missions across 28 countries, delivering free medical and surgical care to under-resourced communities. Dr. Shah's work is deeply rooted in the principles of Jainism, through which he advocates for compassion, humility, and nonviolence in healthcare. As a retired physician, an educator, and humanitarian, he has spent decades uniting clinical excellence with a global commitment to service. Dr. Shah, thank you for joining us today. It's a privilege to have you. Can you tell us a little bit about yourself?
Thank you. As you said, anesthesiologist means I put people to sleep and wake them up and then send them my bill. So that's what I did at Long Beach VA Medical Center. And I still continue to work in the ICU of Loma Linda University. And it has been an honor for me to start my journey of humanitarian missions about 33 years ago when I came to Los Angeles.
It's awesome. So Dr. Shah, your career spans critical care, anesthesiology, global humanitarian work, and leadership in some of the most complex clinical environments. But before we get into the big picture about all of this, I'd love to start at the beginning. What keeps you going today? After all these years in such intense environments, what do you still love about being a doctor?
Good question. I think a physician is a very noble profession. And you get tremendous satisfaction. And don't get me wrong, most other professions have their own ways of getting that feeling. But as a physician, it makes it a little bit easy because you deal with somebody directly, a human being, and take care of their problems, and the feelings and the happiness that you get is certainly pretty good.
Definitely. Thank you for sharing that. And I would also further like to ask, are there any moments that changed you, not just as a physician, but as a person overall?
I've gone through personally a lot in my life, and every challenge I've taken as an opportunity to do better. And I am very humble to have gone through things, and that has saved me. Is there any particular moment? Yeah, I would probably say one thing, losing my first wife at a very young age when my son was 8.5 years old. That was certainly a defining moment. And I was so fortunate that I could get my parents to literally move with me here from India and help raise my son. And I'm very proud to say that he has grown up well, and he's an entrepreneur and has got his own things that he does on his own. And that certainly is a tremendous satisfaction to me personally as a father and a mother that I could do that.
Thank you for sharing that personal story and how you kind of grew from those moments as well. And I wanted to ask you specifically, having gone through so much hardship in your early life, what drew you essentially to medicine and specifically the fields of anesthesiology and critical care?
You know, I wish literally you didn't ask me this question because what I'm going to tell you is really a kind of a surprise. When I was growing up, when I was in the first year of college back in India, out of 1,200 students, 45 students will get direct admission into medicine. Had no desire to be a doctor, but my family knew these facts. And I wanted to be a chemical engineer, do business, and then do charity. As the destiny would have it, I was third out of those first 45.
Wow.
And my family all decided I'm going to be a doctor because there was no doctor in an extended family of mine. So by default, literally by default, I became a physician. I did not have nerves to tell no to my family that I want to be an engineer and do business, whatever. So I don't have any regrets. But as a comment, I would say if you give me 50 years back, I probably would want to change and do something different. But that's how I became a doctor. For anesthesiology, remember, I'm into medicine and I'm really above average, not doing that great because I don't have still interest in medicine. So I was passing, of course, because I come from lower middle class family. So I didn't want to lose years and all. So I passed. And then, so when I finished, I didn't have enough good grades. By the time I wanted to be a surgeon, but I didn't have enough grades to get into surgical residency. So I had to settle for anesthesia. Now, in hindsight, at least that part is very good. I love being an anesthesiologist. Then, as the luck would have it, trained in Baroda, India. Then I went to Zambia and Zimbabwe for 7.5 years. And then I came to New York. And in New York, I did my residency in reverse order. So I did fellowship and then other years. And my last year happened to be critical care fellowship, again by default, not by choice. But my chairman at Sloan Kettering Cancer Center, where I was, and New York Hospital, that's part of Cornell University, they said, we are not going to make you intern as your last year, we're going to make you as a fellow. So because I did the critical care fellowship and that was counted as an internship, I did another one in UC Irvine where I moved to Los Angeles. That's how I became an intensivist. And guess what? I definitely like what I had to go through this because, there is one very important concept in Jain religion, which I believe in, and that is process of dying. It is called salekana, and it is prescribed in the scriptures. So it's thousands of years old, and this is what one does when your time is up. And I'm fortunate that having raised Jains, having understood this concept, I'm able to utilize that in practical aspects of my career. Thanks.
Awesome. That is so funny. Thank you for sharing that, how you got into medicine and how you got into anesthesiology. I'm sure you would have been an incredible chemical engineer and businessman as well, but we are so lucky to have you go into anesthesiology and critical care to be able to influence so many different people through your missions. And that's actually a perfect segue about what we'll talk about next, your humanitarian missions and global health initiative. So you've led over 350 medical missions through the Aparigrah Foundation and the ACC Foundation, a remarkable legacy of service. So what originally inspired you to launch these foundations, and what does the principle of Aparigrah specifically mean to you?
Yeah. As a Jain, there are three tenets that we believe in. One is ahimsa, which is nonviolence. Second is anekant. Anekantvad means multiplicity of views. There is no single truth. There are multiple truths. Like, I can go to New York many different ways, etc. And then the third principle is which is non-possessiveness. It's not only money, but even your knowledge, your abilities, share everything with people. So when I was growing up in Los Angeles, I happened to be a past president of Jain Center of Southern California as well. And during that time, we learned, when I say I, obviously, it's always a group of people for everything that we do. That to do humanitarian work, we need to step out of the religious principles. We carry the principles, we follow them, but we don't exactly do because there are restrictions and things like that within the religious boundaries. That's why to do humanitarian missions in Southern California and around the world, we formed Anekant Community Center. That was done in 2005. Then we wanted to do some specific things within humanitarian work, which me and my friend Rohkora, we felt we should do this under a separate foundation. So that's why we created Aparigrah Foundation. So Ahimsa, I am a founding sponsor of Ahimsa Center at Kelpoli, Pomona. That happened in 2004. 2005 started Anekant Community Center. So it was easy to pick the third name. it has to be on Aparigrah. So Aparigrah Foundation. That's how the three names come.
That's incredible. Thank you for sharing the principles of Jainism that you use to influence your humanitarian work. That's so, so special, and I'm sure it means a lot to you as well and connects you to these missions. So, out of the many missions that you've led, is there one that left a particularly deep impact on you, perhaps reshaped how you think about medicine, suffering, or even your personal ideas?
There are many, but I'm a goal oriented person.
Mm-hmm.
So I want to see the results. And we like to plan and then see when the plans come through. So based on that, I'm going to describe three or four where I see larger benefit based on our desire.
Mm-hmm.
My number one is we do free surgeries in a hospital called Kalidas Hospital in Viara, Gujarat, India. We started this in 2007. We haven't stopped. Every year, we work only 3 days of surgery. A lot of planning before and after, but in 3 days, we operate on average 150 patients. And these are hernia, hydrocele, hysterectomy, etc. Consistently over 18 years, we've been produced these results. Number two, locally, the city of Anaheim invited me to do free community health fairs for them. Incidentally, that was also 2007. And we started that year after year. Now we have literally moved to Anaheim Convention Center from 2014. And remember, CT arranges the facility and our group arranges all other aspects, the volunteers, the equipment, different tests that we offer and things like that. It has continued till today, continues to grow, and I'm happy that we are able to serve 1,000 plus people. And now, thanks to Leicester Knight Free Clinic, we are even able to take away tooth on site, and we will give you eyeglasses also on site.
Wow.
So if you walk in, you can walk out with all those things plus blood test and bone density assessment, EKG, pap smear, mammography if you are women, etc. Everything can happen in that weekend. Third, this is actually my pride, my desire for over 25 years, which is going to come through this year, and that is first free surgery center in America.
Wow.
We have built one. We are waiting for the final approval. We can't wait to start free surgeries in Los Angeles area from July of this year. And this had been my dream for 25 years. The details, but it has become real. There are 2 operating rooms, and we'll be able to offer free surgical services, outpatient based. Of course, there are limitations, but we will do endoscopes, cataracts, cystoscopies, biopsies, hernias, and things like that. So that's the third. I won't go into the international, but Ghana has been phenomenal. Zambia has been phenomenal year after year. Jamaica, we have gone 8 times, and there again, we operate only 3 days. And there we do cataract surgeries. Last year, in 3 days, we pulled up 611 surgeries.
That's insane.
So,
wow.
All these numbers are absolutely phenomenal. The last but not the least, that happened just this month. I came back from Fiji. Even though our second trip, but this mission was the first one with this group, we had given them a target of screening 25,000 children and staff in 5 days. We were there for 6+ days, so 6 to 7 days. I'm happy to say we could cater for 25,350 children in those days. So that was pretty good too. I think I gave you too many, 5.
No worries. That's insanely incredible. Wow. Thank you for sharing all of that. And, we're so excited to see about what is going to come in LA and you finally accomplishing your dream of being able to open the surgical unit in Los Angeles. That is so exciting. And I hope that goes just as incredibly well as the rest of your global missions. So you have emphasized consistently on sustainability. And while short-term missions can do great good, how do you think creating long-term impact in the communities you serve? And what does responsible global health look like to you?
I have to admit, on a long-term basis at any place, we haven't developed things that continues whether we are there or not until recently.
Right.
From last year, we have started doing that. So there are places, Nigeria, Zambia, Kenya, Ghana, and soon to be Uganda, and of course India, where now we have set up the vision screening. We do it with a very simple machine, and it literally takes 10 to 15 seconds in a child, 20 seconds in an adult. All we are looking at is whether you need eyeglasses or not. So our goal is to do 1 million children around the world this year. By the way, last year our goal was 100,000. We did 165,000 in 10 countries. We have kind of made it so simple that literally, Hargun, if you want, I can train you in 10 minutes and you'll be able to carry it on. So that is what now I'm working on, that things will happen in different parts of the world while I will still be sitting at home. I haven't made it that good yet, but I'm working on it. And I have to say, Kenya is my first model where things are happening. I work with Light and Hope Initiative. We run 2 days a week free clinic, and we are doing other vocational training courses, etc., that we are supporting from here. So that's my model. I'm going there next month in July, and hopefully we will expand on that in other parts of the world.
Wow, that's incredible. And I know you're talking about you having sustainability in absence of you being the founder in presence, but we can see throughout the years of work that you started in the 2000s, it's still continuing now every single year. So that's incredible. And I think you have created such an impact, and I'm so excited to see what more will come this coming year. I'm very excited. And I know you mentioned a little bit about your faith and how it intertwines in your perception on medicine and humanitarian care. So, as your humanitarian work is clearly rooted in your ethical and spiritual foundation, how has your personal faith or value system shaped the way that you want to practice medicine, lead terms, and serve communities in need?
A good question that you ask. I will go back in history again. I spent 4 years of my high school with my maternal grandparents, and I give a lot of credit to my grandfather because I learned a lot about giving without talking, giving without expecting from him during those years. And that has been described incidentally, Argun. I am currently working on for Arihant Institute 4 hours of online class, and that is about interreligious approaches to compassion in action. So the first part of each is to talk about different religions' beliefs in compassion. And the second half is what you are listening about my work, because we also do other aspects and other things in California and other parts of the world. Coming back to, so during those 4 years, I learned a lot about giving, compassion, etc. And yes, my upbringing is as a Jain, but I would say I'm open to work with anybody, anywhere as I have been. And I respect all religions. And more I read for my classes that I'm recording. I'm done with two and I have to record two more. Every religion talks about compassion. So then, as far as at least I'm concerned and my work is concerned, I don't have to worry about a particular religion because nobody's going to dispute what I'm trying to do is wrong. Every religion does tell, go help people. And that's all I do. And of course, as a Jain, I don't just say help people, I say help all living beings. And believe it or not, I have been involved. This is a good story, Hargun.
Sure.
You know, during Thanksgiving, what happens in America? A lot of turkeys are slaughtered, right? About 5 years ago, I got a call from one Midwest place. I have no idea how did he find my number. He calls me and says, I have a turkey who has lost one leg. And I know you have some association about prosthesis for animals and birds. Can you help me? Guess what? That Thanksgiving, I was able to connect him with the Bidra Sarvodaya Trust in India, who make prosthesis for animals and birds. And they were able to send a little prosthesis for that turkey, for that gentleman. So, you know, helping people, that's the ultimate bottom line without worrying about religion, caste, creed, or anything.
And that's incredible that somebody was able to find you through that correlation. That's so funny and that's so insane. And I'm so glad that you were able to be a part of that as well and help him through that. So, as you
Yeah.
often say and speak about compassion and action, in a clinical world, this can be kind of fast paced and emotionally draining. So, what does a phrase mean in practice to you, especially when you're caring for the most vulnerable or critical conditions?
I have always loved challenges in my life,
Hmm.
and I certainly had fair share, but that hasn't shaken me, obviously. I'm okay and I'm ready for more.
Hmm.
But it is that drive that still continues in me,
Right.
that still keeps taking me, what next? What more?
Mhm.
And I'm very fortunate that my son, being so close to me, being a single parent, so to speak, that when I told him in 2023 November that I'm going to retire last year and I'm going to do 100,000 screening, he right away said, okay, Dad, start thinking how can you do 10x in 2025? That is this year. We are
Mhm.
certainly not very close to 1 million yet, but there are processes happening in
Mhm.
multiple places. But the point I want to make is that's my drive. I love challenges. I want to solve problems. And of course, my focus is all in humanitarian work. Anything that I talk about, unless it's for free, I'm not in it. And that has become the mission of my life for the rest of my life.
Thank you for sharing that. That's a great way to end that segment. And beyond your clinical and humanitarian work, you've also impacted so many as a dedicated mentor. You've mentored countless young physicians over the years. So, what qualities have you seen that you believe future physicians need most, not just clinically, but ethically and globally?
Yeah, I'll give you one simple example
Hmm.
of what people of probably not just your generation, but a little bit older also than your generation.
Hmm.
I was in Viara 2 years ago, and
Okay.
we had one anesthesiologist from University of California and volunteering.
Hmm.
And we just started talking. God knows where the talk came from, but we started talking about late Mahatma Gandhi.
Okay.
And yeah, we talked little, and then he says, Dr. Shah, he was a great man, no question. But he was then. Circumstances, surroundings, everything has changed so much.
Mhm.
We are looking for modern day Gandhis.
Right.
And he right away said, well, he says, Dr. Vivek Gulati is his name. I'm looking at you. You brought me here, gave me this opportunity. This was in Viara where we were doing 160, 70 surgeries in those 3 days. And he was one of the anesthesiologists helping me. So that is what I think the current generation needs.
Hmm.
Living examples of people doing things which is touching, which is free, which is with compassion, which is with humanity, etc. Stories are great.
Right.
People who brought us here are obviously wonderful, but
Hmm.
still, the current generation does not relate that
Hmm.
well to that. That's my impression. I
Hmm.
just gave you one example, but obviously, there are a few that I have who are all looking for what can I do today and who can I see today doing something.
Hmm.
And that's, I think, the important part. And that's how Maurice and Sneh got to me, and we were there to develop their first nonprofit, etc., and did some work. Thanks.
Hmm. That's awesome. Thank you for sharing that. And I'm sure many students and many healthcare professionals right now can understand and take from that as well to really leave an impact and to be, as you quote unquote said, the modern day Gandhi. That is what we strive for as well. So, how do you personally define a life of impact? And has that definition for you changed over time throughout your missions and your global work?
What has changed is in the beginning, I was happy when I can impact 20 people or 50 people.
Hmm.
Now that limit has certainly increased. Why can't I do more?
Hmm.
And some people also have called me, including my wife. Are you just after numbers? I said, well, I am after numbers, but along with the quality, it's not that I'm just collecting numbers for the sake of numbers, but why can't we do more? That has been the push that I have developed for myself.
Hmm.
And of course, some of them translate into all the volunteers who are working with me as well. Occasionally, it does appear like I'm pushing too much, but I love challenges and I want to bring people into those challenges and see how can they come through. And there are many examples who have done wonderfully. I mean, I have one young girl, Jameen, she's through one of our donors. They said, "Oh, do you want to use any volunteer help besides money?" I said, "Yeah, I'm always looking for people." She has been with me so far in Ghana, Cameroon, Nigeria, African countries, Nepal, India, and she was with me in Fiji. And I can tell you the vision screening aspect and the anemia screening, those two aspects, she has literally mastered it. I will not have any doubt if I give her an assignment that it will not come through. No, and she's just one young person, but I've got 3, 4 other people, Umesh Amin, Nisit Choksi, they are just phenomenal. And that is what I'm trying to develop more and more young people who can carry on things.
Right. And as you stated, it is numbers, but it's also not numbers, just numbers. It's impacting that many people's lives that you're able to do. So that's incredible. And you're always striving for further and further impact. So that's a great thing to hear. And before we wrap up, I like to ask a few short reflection questions. What's one belief or practice that you've reevaluated in your career?
If you allow me, I'll give you a little long answer.
No worries.
This is a funny answer, so I'm sure you're going to enjoy it.
Sure.
In general, Dalai Lama said that I believe the purpose in life is to seek happiness. Do you agree with me?
Yes.
And I'm sure most people will agree. So now here I am, born Indian, now American, lived in Africa for a bit, but never went to China. But I had to go to China to find a Chinese proverb that is the secret of happiness that I think people will enjoy. Here it is. If you want to be happy for an hour, take a nap. If you want to be happy for a day, go golfing. I don't golf. If you want to be happy for a month, get married. If you want to be happy for a year, inherit fortune. Money will not keep you happy for so long because you can neither eat, drink, or sleep with money. But if you want to be happy for a lifetime, go help someone else. When I said this to my daughter in law, she said, "Yeah, Dad, it makes you feel good, but it doesn't last." I said, "Yes, that's why you need to do this every single day." And I'll give you a last quote that's mine.
Yes.
True happiness comes from serving an unknown, someone whom you don't know, someone from whom you don't expect anything in return. Thank you.
That's an incredible line. And I'm sure any listener listening to this is going to take that with great care. That is very, very incredible. Thank you for sharing that and the Chinese proverb that you learned as well. And I think that's a great reflection of the work and ultimately how you continue to be able to continue with your humanitarian work today. So thank you for sharing that. And then I would further like to ask you, what is your vision for a future where healthcare is guided by compassion and equity? And I know you mentioned that you would hope for the next generation to be impactful. Is there anything else you would like to see or share?
Yes, I would like to make a greater impact in terms of vision where, we are focused a lot more on children. Nothing wrong in adults, obviously. We take care of them as well. But if we change the life of a 6-year-old, 8-year-old, or 9-year-old, it's the rest of his or her life. And it is relatively so simple way. So I'm just pushing that if we can go and take care of hundreds of thousands of children around the world. So that's one wish. Doing simple, basic free surgeries isn't very complicated. And I wish more people come up and ask and follow the things that we have developed. It will be definitely helpful. And going to rural areas to help is definitely very, very important. Currently, the Kenya that I mentioned, we are working in Mathare community. And I'm very thrilled and happy to know more and more youth are interested in doing different things and seeking assistance for that and coming up with creative ideas. I'll give you one example. As a girl, you will understand the menstruation and the problems in the community. They don't have enough hygienic things. So one
100%.
girl about 4 months ago approached me out of the conversation that they want to make reusable sanitary pads. And guess what? The ask was not a whole lot, We supported her.
Wow.
And now that has become a sustainable business in that community and doesn't even require our support. And the girls are very happy because during menstruation now they are able to go to the schools rather than taking time off. So
Mhm.
these are small, small things, but they are very helpful and impactful. We're
Mhm.
looking at changing lives with that. Thank you.
Right. Thank you for sharing that. That's great. And finally, is there a message that you would like to share with the next generation of healthcare leaders, as you just mentioned and reinstated?
Well, just consider helping people
Hmm.
any
For sure.
which way,
Hmm.
helping all living beings any which way you can.
Hmm. For sure. Thank you. Thank you, Dr. Shah, for sharing your remarkable story and for illustrating how medicine can be a vehicle for both healing and humanity. Your example challenges all of us to lead with intention, compassion, and service. So, for those who would like to learn more about you and your work and maybe even get involved, where can they go to find more information?
My email,
Hmm.
nitinshahmd@gmail.com. Just
Hmm.
reach out to me. And my phone is also literally a public phone in Southern California. So I'll give you that too. 1-244-9035. I do request, please text before you call so that I can answer that otherwise. But yeah, and this course that I'm doing for 4 hours under
Hmm.
Arihant Institute, I am actually talking about how to organize free community healthcare, how to
Hmm.
organize free international missions, how to help. There are two other things that we didn't get to talk about. One
Hmm.
is Anekant Community Center over the last 20 years have done fundraisings in several natural disasters around the world. Actually, there are about 24. And out of which few of us, mainly me, have traveled to some of the countries.
Hmm.
India, after India earthquake, Kashmir, I visited Pakistan after Kashmir earthquake, Haiti, Nepal, and 2 years ago I was in Turkey after the Turkey earthquake. And we are helping those areas in our small way of how to rehabilitate. And the second thing, during COVID, we started making free meals.
Wow.
So for homeless and shelters, every Saturday now we make 600-700 meals, and every other Sunday we make 600 meals. So on an average, 1,000 meals a week we have been making for homeless people, and these are freshly cooked hot meals that we serve, pasta
Hmm.
based, rice based, etc. So anything that you want to do, I'll be happy to help, because my first class is about the healthcare mission, second class is about how do you cook, third class is about how to help in natural disasters, etc.
Hmm. Wow.
So
That's awesome.
number, email, reach out to me if you want to do something. I'll be happy to hold your hands and talk.
Awesome. Thank you. Thank you, Dr. Shah. We're so grateful to have had this opportunity to speak with you, and we look forward to sharing this conversation with the rest of our audience as well. We hope today's conversation sparked reflection and affirmed that youth voices and mentors are essential to building a more just and responsive health system. If you're ready to take the next step, visit projectunitynfp.org to connect with changemakers, explore student-led initiatives, or get involved with future episodes. I'm Hargun Sachar, and on behalf of Project Unity, thank you for listening. See you next time on On Call.